Has it been solved, resolved? Okay, please come.
Yeah.
Good afternoon, everyone. My study is based on study on ocular manifestations of NF1 type 1 at Tertiary Care Teaching Institute. Neurofibromatosis is an ocular neurocutaneous syndrome with multisystem involvement, characterized by cutaneous neurofibromas, scapholate spots, axillary and inguinal freckles, leash nodules, orbital neurofibromas, and optic nerve gliomas. The aim of my study is to identify common ocular manifestations, assess the impact on vision, and highlight the importance of early intervention. This is an observational study done at Rio RIMS Ranchi, including 36 NF patients. The diagnosis was based on national NIH consensus. A detailed clinical assessment was performed, including history taking, visual acuity assessment, slit lamp examination, fundus evaluation, and imaging where necessary. These are the inclusion and the exclusion criteria. Results. My study included 36 NF patients, 21 were female and 15 were male. Age of presentation. This chart depicts the age of presentation. Majority of patients presented at the age of 46 to 60 years. This is a chart depicting the ophthalmic manifestations noted. Leash nodules were noted in 30 patients. Neurofibromas on eyelid and eyebrows was noted in 30 patients. Plexiform neurofibroma of eyelid was noted in 8 patients. Orbital neurofibroma was noted in 8 patients. Coloboma of choroid with macular involvement was seen in 1 patient. These are the images. Visual acuity of patient. Vision more than 6 by 12 was seen in 24 patients. Visual impairment was seen in 12 patients. Out of the 12 patients with visual impairment, the cause of amblyopia was only due to plexiform neurofibroma in 3 patients, only orbital neurofibroma in 3 patients, both plexiform and orbital neurofibroma in 5 patients, coloboma choroid in 1 patient. The genetic pattern of disease transmission. De novo mutations were noted in 8 patients. 2 generations affected was seen in 9 patients, and more than 3 generations affected was seen in 9 patients. Neurofibromatosis is a group of autosomal dominant disorders characterized by neurocrystopathies leading to the development of benign and malignant tumors at an increased frequency. NF1 gene is located on chromosome 17 and has a high mutation rate with up to 50% of cases caused by de novo mutations. Diagnosis of NF1 is primarily clinical based on NIH consensus development criteria, requiring at least 2 of the following: 6 or more scapholate spots, 2 or more neurofibromas, axillary inguinal freckling, optical nerve glioma, 2 or more leash nodules, characteristic osseous lesions, or a first degree relative with NF1. About 25% of NF patients develop complications including plexiform neurofibroma, optic nerve glioma, orbital neurofibroma, and neurofibrosarcoma. Orbital neurofibroma, the most common cause of amblyopia in NF, accounts for 0.8 to 3% of histologically confirmed orbital tumors. Localized orbital neurofibromas typically presents in young or middle-aged adults. Early diagnosis and treatment of plexiform neurofibroma, orbital neurofibromas, and optic nerve glioma reduce the risk of amblyopia and compressive optic neuropathy affecting 5% of the NF patients. Management of localized orbital neurofibroma involves total excision, though post-operative sensory skin deficits occur in 72% of the cases. Complete tumor dissection is possible in 46% of cases. Plexiform neurofibroma is treated with excision and eyelid reconstruction. So I conclude from my studies is uh, leash nodule is leash nodules in the iris and neurofibromas of eyelids were the most common manifestation of NF patients in my study. Visual impairment occurred in 33% of the cases due to stimulus deprivation amblyopia or compressive optic neuropathy, which could be mitigated with early diagnosis. De novo mutations accounted for 50% of the cases. These are my references. Thank you.
Thank you for presenting this case. So what exactly this study wanted to find out? Only the ocular manifestations in neurofibromatosis or something else you wanted to see?
Ma'am,
So,
yes.
Yeah,
ma'am.
so you told list nodule is the first, which is common.
Yes.
So, did you see any optic nerve gliomas in your cases?
Yes, ma'am. Only one patient had optic nerve glioma.
And how do you manage these cases? How do you manage the amblyopia therapy in these cases? You are saying most of them had amblyopia. So, what did you do? Because most of your patients are already in the age group of 40 above, you are saying.
Yes, ma'am.
So, how can amblyopia build in after such a age? So, that means they must be having a manifestation earlier. Did you take that history also into account?
Ma'am, history was noted. Yes, ma'am. I'm getting.
So, did you do some kind of correlation or association between the different types of clinical presentations that you found? Like, if this is there, then that might be there. Did you find that kind of association in your study? Although the number is very less, I agree, but still, was there any kind of association like this?
Ma'am, the patients had like most of the patient they had leash nodules and I'm sorry, ma'am.
Okay.
Thank you,
Yeah.
ma'am.
Yeah, what, yeah. What was the incidence? Did you compare the incidence of neurofibromatosis in our country along with the Western world? Do you find any difference, in the incidence of neurofibromatosis in our country compared to the Western world?
Uh,
Do you have any statistics about that?
no, ma'am.
Okay.
So you just you collected the neurofibromatosis patients and saw the ocular
Yes, ma'am.
presentation.
Yes, ma'am.
Do you feel that as madam had asked a question, amblyopia related to optic nerve, neurofibroma?
Yes,
Do you
ma'am.
think is there a role of once you have eh, what was the treatment that you did? You excised the tumor was excised, the neurofibroma on the optic nerve was it excised?
Ma'am, it was not done in our center.
What okay. So do you see any role of neuro neuro rehabilitation or rehabilitation in these cases where there is an amblyopia or a loss of vision at the age of 40 45, because all your series were elderly middle-aged patients, right?
Yes, ma'am. Yes, ma'am. Rehabilitation.
Anything that you did for the cosmetic reasons? Because I see many patients with neurofibromatosis, they have a lot of complex, isn't it? Because they have lesions all over the body,
Yes, ma'am.
isn't it? It's a big social stigma.
Yes, ma'am.
So do you feel that there is any role of a psychiatrist or a counseling for these
Yes,
patients?
ma'am. There definitely is a role for psychiatric counseling, and also, ma'am, cosmetic surgery, plastic surgeries also play an important role in rehabilitation of these patients.
Thank you.
Thank you, ma'am.